the symptoms of polycystic ovarian syndrome. Have you been asking yourself, what are the symptoms of polycystic ovarian syndrome? In this video, we are going to discuss everything about polycystic ovarian syndrome. So without further ado, Gerald Massa, the health educator, are the names of the channel you are on. I welcome you if it's your first time on our channel. On this channel, we do create awareness about fertility and reproductive health. Polycystic ovarian syndrome is our topic for today. What are the symptoms of polycystic ovarian syndrome? The first symptom you are most likely going to see is one of irregular periods. When you are experiencing irregular periods, you are supposed to see your periods this month, maybe today, but you've not seen your periods. 2 weeks pass by, you have not yet again seen your periods. This could actually be an indicator that there's something happening in your system. It could be a sign of polycystic ovarian syndrome. But remember, there are many other causes of irregular periods. But if you experience irregular periods, it could be among the signs that you could actually be developing what we call polycystic ovarian syndrome. Next symptom for polycystic ovarian syndrome is that there's going to be difficulties getting pregnant. Remember, we've said that you could begin developing irregular periods. If the periods are irregular, then it means that you may actually find it difficult to track your most fertile days because the periods are irregular. So it brings us to the next point of difficulties getting pregnant. You may try to get pregnant and things are not working out well. This could be that you need to take time to track your menstrual cycle, to track your safe days and your danger days. So difficulties getting pregnant is our next sign of polycystic ovarian syndrome. Next sign of polycystic ovarian syndrome is there's going to be what we call excessive hair loss. Most doctors call this alopecia. If you are experiencing hair loss at a very high rate, then this could actually be a sign that you are actually having polycystic ovarian syndrome. Remember, there are many other causes of hair loss. For example, if you have hormonal imbalances or hormonal changes, high estrogen levels, you could actually also experience hair loss. But in this case, we are discussing polycystic ovarian syndrome. If you are experiencing hair loss, you have irregular periods, you are having difficulties getting pregnant, this could actually be a sign that you could actually be having what we call polycystic ovarian syndrome. The next symptom we are going to discuss about is acne. In most cases, you may actually begin developing pimples or lots of oily skin, and this could actually also be an indicator that you could be having what we call polycystic ovarian syndrome. The next symptom for polycystic ovarian syndrome is rapid weight gain. You may actually begin putting on weight, you as a woman, and you may ask yourself, why are you putting on too much weight? Why are you having difficulties getting pregnant? Why are you having irregular menses? And why are you losing your hair at a very fast rate? It is high time you did checkups for polycystic ovarian syndrome. What are the checkups for polycystic ovarian syndrome? I will discuss more in our next video, but in a nutshell, the first test for polycystic ovarian syndrome is what we call a pelvic ultrasound scan, also known as gynecologic ultrasound